Hey everybody, I'm getting a lot of calls about seasonal allergies, so I wanted to give you a few tips on how you treat them with over-the-counter medications. In order to know how to choose the correct medications, it's important for us to understand why we're having these allergy symptoms in the first place. And the reason why you're having these symptoms is because you've been exposed to some type of allergen. An example of an allergen would be pollen, dust, pet dander, household chemicals, or even perfume. So since the topic is about seasonal allergies, we'll choose pollen as our example for today. So once you become exposed to pollen, it binds to a special cell called a mast cell. Now, the mast cell is a part of our immune system, and its job is to recognize foreign substances. And when this happens, it ultimately leads to an inflammatory response in an effort to remove that foreign substance. Pollen will bind to the mast cells, which will then release a chemical called histamine, which will lead to your allergy symptoms. Because mast cells are a part of our immune system, they can be found in various locations throughout our body. But when it comes to your allergies, it's mainly going to affect the mast cells that are in your nose, your eyes, your throat, and your sinus cavities. So it makes sense that this is where all of your allergy symptoms occur. Histamine causes three major symptoms: itching, swelling and congestion, and leakage. So what does that look like in terms of our symptoms? So for the itching, you're going to be rubbing your eyes, rubbing your nose, snorting. You'll be sneezing and having a scratchy throat. For the swelling and congestion, you'll have puffy eyes, a stopped up nose, and pressure in your sinus cavities. So it's important for me to note that just because you feel pressure in your sinus cavities, it does not mean that you need an antibiotic, because that pressure could be due to a various number of things, which include allergies, okay? So just because you feel pressure in your sinuses, it doesn't mean that you need an antibiotic. But that's a side note, and I'll come do another video about sinus infections at a later time. For the leakage, what you'll notice is that your eyes are watery, your nose is running, and you'll have postnasal drip or drainage going down the back of your throat. Now that we have a better understanding of what allergies are and how they present, now we can talk about what medications we can use over the counter to help combat our allergies. The first medication that you're going to pick up is going to be a nasal steroid. So one of the more popular ones would be Flonase. You also have Nasacort and Rhinocort that are available over the counter to use. So let's think about it. When you go outside, you breathe in the pollen. Where's the first place that it's going to hit? Your nose. And so that's why you're choosing the nasal steroid, is because you want to use the medication in order to kind of prime those mast cells before they even come into contact with the allergen, which will then lead to those allergy symptoms. And so when you're using the nasal steroid, it's really important that you have the correct technique when you are using them. Make sure that you're looking straight ahead. Don't tilt your head back, because the medication will just drain down the back of your throat and you want it to stay in your nose. So you're going to look straight ahead, you're going to spray, and then you're going to sniff very gently, okay? So 2 sprays in each nostril daily. Consider cleaning out your nose with a nasal saline solution or mist, or some people even use sinus rinses. And the purpose of that is to get rid of all the dust and the pollen and the mucus out of your nose before you actually apply the medication that's in the nasal steroid. Now, the nasal steroid can be used, like I said, it's used daily, and it can be used at any time. Me personally, I use mine at night because that's when my postnasal drip is the worst, and that's what I hear from patients as well, is that their postnasal drip is worse at night and in the morning. So that's when I use my nasal steroid, but you can use it at any time during the day. As a side note, postnasal drip can cause a reflex we call cough. And so some people, I notice when they call, they say, I don't know if I have allergies or if it's a cold, or if you have those three main histamine symptoms, the itching, the swelling, congestion, and the leakage, along with the postnasal drip and the cough, and you know that you have a history of seasonal allergies, then it's your allergies, okay? Another thing I notice is that patients will say, well, I used a nasal steroid and it really didn't work for me. And then I ask, how long have you used it? And they'll say, oh, it's been like 3 or 4 days. Well, technically, it can take up to 14 days for the nasal steroid to reach its maximum performance. Now, some people will have immediate relief. Some people, it might take 2 to 3 days, some a week, but you do need to stick with it, at least I would say for 3 weeks before you give up on it, okay? All right, so remember that we're using the nasal steroid to treat those mast cells that are in our nose before we even come into contact with the pollen, because we're trying to decrease or tamper down the inflammatory response that's going to occur as a result of the pollen binding to the mast cells. Now, the second medication that you're going to pick up is actually the over-the-counter allergy pills, which are known as antihistamine, because they are there to decrease the amount of histamine that has already been released as a result of the pollen binding to the mast cells. And so you want to decrease the histamine in order to decrease the allergy symptoms that you're experiencing. Now, there are a lot of different options that you have in terms of over-the-counter antihistamines, but it's important to know that they are divided into 2 separate groups. So the main difference between the two is one group is what we call sedating, which they will make you drowsy. And then the other group is non-sedating, so you don't get that drowsiness effect. And the reason why you get the drowsiness in the first place is because the other group, the sedating group, it crosses the blood-brain barrier. I'm not going to get too much into that, but that's why you get the drowsiness. Now, the most popular antihistamine in the sedating group would be diphenhydramine, which the brand name is Benadryl and is very popular. So that's what I see most patients taking. I do want you to know that there is an alternative that is in that group that is over the counter, and that is called chlorpheniramine. And that one happens to be the least sedating out of the group. So if you are a person and you find that Benadryl is a little too much for you in terms of how it affects you, the chlorpheniramine may be a better alternative. So the non-sedating group consists of Claritin, Allegra, Zyrtec, and Xyzal. What I usually recommend is for patients to start with one of the medications in the non-sedating group. They work pretty well for your symptoms, but the ones that are in the sedating group, so the Benadryl or the chlorpheniramine, those tend to work a little bit better if you're having issues with runny nose. So if you have to add one from the sedating group, you can do that, and I usually tell patients to take that at night just because it is sedating and can cause drowsiness. Now, there are other over-the-counter allergy medications that you can take to help with your symptoms. They make antihistamine eye drops, so that will be for you that are having watery eyes or itchy eyes and they're really bothering you. So you can take that. You can also take a decongestant if you notice that the congestion is bothering you. There are some side effects with those. They can raise your blood pressure. They can make you irritable and more anxious. And so be mindful of that. The allergy medications, the pills, the antihistamines, they do come in a combination with decongestants, and you can pick those up over the counter as well, and they're usually behind the counter at the pharmacy. I know in the state of Mississippi, they had a law where you had to get a prescription in order to get one of those combination medications, but that they have a new law that took place in December of 2021 where you will be able to get them over the counter now. So those are the over-the-counter medicines that you're going to use for allergy treatment. First line treatment is the nasal steroids. Second line treatment would be the antihistamine pills. And then you have some other medications that you can use as well. Everything that I just told you is what I counsel my patients on when they call me about their allergies. And if they've done all those things and they're still having issues with them, then there are some prescription medications that we can send to try to help combat your seasonal allergies. So hopefully those tips will help you in managing your allergy symptoms at home. If you're still having difficulty, then call your healthcare provider for assistance. All right, hope you guys have a great day. Bye-bye.